You think it's just a belly, just a few extra pounds? No, belly fat is not about how you look. It's a dangerous organ that's slowly killing you. I'm a therapist and gerontologist, Dr. Emily Carter, and today I'll tell you the truth about visceral fat that your regular doctor might not explain. Let me explain something important. There are two types of fat in your body. First type, subcutaneous fat. This is the fat under your skin. You can pinch it with your fingers, on your arms, legs, hips. This fat is not dangerous. Yes, it's not beautiful, but it won't kill you. Second type, visceral fat. This is belly fat. It's around your organs, liver, pancreas, intestines, heart. You cannot pinch it. You cannot see it, but you can measure it with a measuring tape around your waist. Here's the problem. Visceral fat is not just storage. It's like a factory that produces bad substances. These substances go into your blood and cause inflammation everywhere in your body. Think about it like this. Imagine your organs are swimming in toxic fat. Your liver tries to work, but it's surrounded by fat. Your pancreas tries to produce insulin, but fat blocks it. Your heart tries to pump blood, but fat squeezes the vessels. How do you know if you have visceral fat? Very simple. Take a measuring tape. For men, waist more than 94 centimeters, that's 37 inches, risk begins. More than 102 centimeters or 40 inches, high danger. For women, waist more than 80 centimeters, that's 31 and a half inches, risk begins. More than 88 centimeters or 34 and a half inches, high danger. Not your weight, not your BMI. Your waist measurement tells the truth. Let me list what happens when you carry visceral fat for years. Number 1, type 2 diabetes. Belly fat makes your cells resistant to insulin. Your pancreas works harder and harder, produces more insulin, but cells don't listen. Eventually, your pancreas gets exhausted. Blood sugar rises. Diabetes begins. Statistics show if your waist is over 102 centimeters, your diabetes risk is 5 times higher than someone with a normal waist. Number 2, heart attack and stroke. Visceral fat releases substances that damage blood vessels. Your blood pressure rises, cholesterol goes up, blood clots form easier, your arteries get blocked. Even if you feel fine now, your vessels are aging faster. Number 3, fatty liver disease. Your liver is covered in fat. It cannot process toxins properly. It cannot produce good cholesterol. Eventually, this leads to liver inflammation, then cirrhosis. The scary part? You feel nothing, no pain, no symptoms, until it's too late. Number 4, sleep apnea. Fat around your neck presses on airways. You snore. You stop breathing many times during the night. You wake up tired. Your brain and heart don't get enough oxygen at night. This increases risk of heart attack by 3 times. Number 5, cancer. Yes, cancer. Belly fat increases risk of colon cancer, breast cancer in women, prostate cancer in men, pancreatic cancer. Why? Because inflammation from visceral fat damages DNA in cells. Number 6, dementia and Alzheimer's. New research shows belly fat damages your brain. People with high visceral fat in their 40s have more memory problems in their 60s and 70s. Number 7, joint problems. Extra weight crushes your knees, hips, back. But it's not just mechanical pressure. Belly fat produces inflammatory substances that damage cartilage and joints. Number 8, hormonal problems. In men, testosterone drops, estrogen rises. You feel tired, weak, depressed, libido decreases. In women, increased risk of polycystic ovary syndrome, irregular periods, fertility problems. Now the good news, belly fat responds to lifestyle changes faster than subcutaneous fat. When you start eating right and moving, visceral fat goes away first. Tip number 1, cut sugar and white carbs. This is the most important rule. Sugar and white flour products go straight to belly fat. What to eliminate? White bread, pastries, cookies. sugar in tea and coffee, sweet drinks, juices, white rice, regular pasta, candies, chocolate bars. What to eat instead? Whole grain bread, brown rice, quinoa, vegetables, as much as you want. Fruits, but only 2 portions per day, not more. Why this works? When you eat sugar, insulin rises. High insulin tells your body, store fat in the belly. When you cut sugar, insulin stays normal, and belly fat starts burning. Tip number 2, eat more protein. Protein in every meal. This is very important. Good protein sources, eggs, 2 to 3 per day is fine. Chicken, turkey, fish, especially fatty fish like salmon, cottage cheese, Greek yogurt, beans, lentils, nuts, but small portions. Why protein works? It keeps you full longer. It helps preserve muscle while losing fat. It increases metabolism. Your body burns more calories digesting protein. Simple rule. Your protein portion should be the size of your palm at each meal. Tip number 3, walk after meals. This is a secret that many people don't know. After you eat, your blood sugar rises. If you sit, it goes to belly fat. If you walk, muscles use it for energy. What to do? After breakfast, walk 10 minutes. After lunch, walk 15 to 20 minutes. After dinner, walk 15 to 20 minutes. Just walk. Not run, not exercise, just a simple walk. Research shows people who walk after meals lose 2 times more belly fat than people who walk at other times. Tip number 4, sleep 7 to 8 hours. Poor sleep makes you fat, specifically in the belly. Why? When you don't sleep enough, cortisol, the stress hormone, rises. It stores belly fat. Ghrelin, the hunger hormone, rises. You want to eat more? Leptin, the fullness hormone, drops. You never feel satisfied. You crave sugar and junk food. People who sleep less than 6 hours have 30% more belly fat than those who sleep 7 to 8 hours. Fix your sleep. Go to bed at the same time. No phone 1 hour before bed. Dark, cool room. No coffee after 2 p.m. Tip number 5, manage stress. Chronic stress equals belly fat. It's a direct connection. When you're stressed, cortisol rises. Cortisol tells your body, danger is coming, store fat in the belly for survival. You can eat perfectly and exercise, but if you're chronically stressed, you'll keep belly fat. What helps? Deep breathing, 5 minutes twice a day. Meditation, even 10 minutes helps. Talking to friends or family, hobbies that relax you. Sometimes just saying no to extra responsibilities. Now let's talk about common myths and mistakes. Myth number 1, I can target belly fat with ab exercises. Truth, you cannot spot reduce fat. Crunches and planks strengthen abdominal muscles, but they don't burn belly fat. You can have strong abs under a layer of fat. To lose belly fat, you must lose fat overall through diet and general activity. Myth number 2, I need to eat very little to lose weight. Truth, eating too little slows your metabolism. Your body goes into starvation mode and holds onto belly fat even harder. Better approach, eat enough, but eat the right foods. Protein, vegetables, healthy fats. Cut sugar and processed foods. Myth number 3, all fat is bad. Truth, healthy fats actually help you lose belly fat. Avocado, nuts, olive oil, fatty fish, these foods reduce inflammation and help burn visceral fat. Bad fats are trans fats and excessive vegetable oils in fried foods. Myth number 4, cardio is the best for belly fat. Truth, cardio is good, but strength training is better for belly fat. When you build muscle, you burn more calories all day, even at rest. Best combination, walking plus light strength training 2 to 3 times per week. Common mistake, drinking your calories, fruit juice, sweet coffee, soda, alcohol, these go straight to belly fat. Your brain doesn't register liquid calories as food, so you don't feel full, but you get all the sugar. Stick to water, unsweetened tea, black coffee. When should you see a doctor urgently? See a doctor if your waist suddenly increased a lot in a short time. If you have belly fat plus constant fatigue. If you're losing weight everywhere except your belly. If you have belly fat plus high blood pressure plus high blood sugar, this is metabolic syndrome, needs treatment. If belly is hard and bloated, not just fat. If you have sudden unexplained weight gain with swelling. Get these blood tests checked: fasting blood sugar, insulin level, liver enzymes, ALT and AST, cholesterol panel, thyroid hormones, TSH. HbA1c, that's your average blood sugar for 3 months. If you're over 40 and have belly fat, these tests should be done every year. Here's your 1-week checklist. Daily tasks: measure waist first thing Monday morning, write it down. No sugar, no white bread, no sweet drinks. Protein with every meal, breakfast, lunch, dinner. Walk 15 minutes after lunch and dinner. Drink 8 glasses of water, sleep 7 to 8 hours. 10 minutes of deep breathing or meditation. By end of week, track how you feel, energy level, mood. Notice if clothes fit differently. Measure waist again on Sunday. Remember, you won't see huge changes in 1 week, but you'll feel different. More energy, less bloating, better sleep. That's your body saying thank you. Let me tell you something important. Belly fat is not about vanity. It's not about looking good in jeans. It's about your life. It's about whether you'll be healthy at 60, 70, 80. It's about whether you'll play with your grandchildren or lie in a hospital bed. The good news, your body wants to be healthy. It wants to let go of that visceral fat. You just need to give it the right conditions. Start today. Not Monday, not next month. Today, measure your waist, cut the sugar, take a walk after dinner, sleep well tonight. Every single day you delay, that visceral fat is damaging your organs. Every day you take action, you're healing. You're not too old, it's not too late. Your body is waiting for you to make the decision. Take care of yourself. You deserve to be healthy. Be strong.